Hi everyone, my name is Dinh. I'm a member services manager. I'm going to be going over the public health emergency unwinding update today. Okay, so the objective for today's is really just to help to prepare for Medi-Cal redeterminations, so that we can keep the coverage for Medi-Cals. And in case you're no longer eligible for Medi-Cals, then how you can continue coverage through Cover California. So just a little bit of background, as you may aware, due to the COVID-19, the federal had declared a public health emergency in 2020. So during the public health emergency, the rules is that no one will be terminated for Medi-Cal, regardless of the income is over, or regardless of the eligibility, except Medi-Cal recipient request to terminate their coverage on their own. For example, if they moved, or some other instant where they no longer want Medi-Cal, that's when they can request the county to terminate their Medi-Cal. But other than that, regardless of what situations, the Medi-Cal cover will remain intact. During the public health emergency. However, the public health emergency is coming to the end. For California's, its endings is actually already end in February 28th. So the protection from COVID-19 is actually end in March 31st, 2023. So by April 1st is when April 1st will be the first day that they start doing the Medi-Cal renewal, just like usual prior to the pandemic. So April 1st will be the first day that they will be resume the process of the Medi-Cal renewal again. And then also April 1st, when they process the renewal, that renewal is usually due in June. So here just a timeline. So like I said, they already started the process in April 1st. And then this timeline is really just apply to those Medi-Cal who due in June. Like I said, because the reason for that is because they usually do it 60 days in advance, just so that in case where they need any verifications, so the client can comply on time before the due date. So 60 days will be the timeline where they usually start a process in advance. So that is the reason why the timeline is only applied to those to those who Medi-Cal is due in June. So April 7th is when they trying to automatically renews, meaning that, they're trying to, using any information in the system, to verify the incomes or family situations, to see, if, the Medi-Cal recipient is, eligible. And if they do, then they will automatically extend it for another year without having to complete the renewal forms. So by April 19, if that one's successful, if that's not successful, then they're gonna have to send out a renewal packet to the recipient, so then they can complete and update the most update situation of their families. And in May 15, if they still have not received the renewals packet back, then they're gonna send out the first reminder letters that is this due, and then you have to send it. And if not, your Medi-Cal gonna be terminated. And then June 2nd will be the second reminder that will be sent out if the renewal packet is still not yet received. By June 20, they will process it at that time, and by June 20, if nothing's been received, then they will send out a termination notice that your Medi-Cal will be terminated because you are in uncompliant with the Medi-Cal renewal process. And the rule of thumb, if Medi-Cal approve for one day, it will approve for the whole entire month. So usually the first cutoff day will be the following month. It will not be, in the mid-month or, any day of the month. So that is the reason why the first cutoff day will be the following the next month, the coming months will be July 1st. And then what to expect, this is pretty much like the renewal package, the envelope that you're going to be expect. Just different than, what used to be. Used to be, it's the plain white envelope, but then, for this year, they make a little bit distinctions. So then, the recipient can be aware of the renewals. The renewal package. So when you see this kind of envelope, please pay a little bit more attention. Don't toss it away or put it away where you probably will forget it in probably in a week or two. And then for the renewal forms, what you're gonna have to pay attention will be, this right-hand corner over here with this box, where it's usually stamp the day that you wanted to complete and return before this days over here. And then for address change, just like what I mentioned earlier, due to because from the last 3 years, we haven't been really doing any of this. But if you do, it's great. But if you don't, even if you do, the county have not really processed any, any Medi-Cal cases. Not to talking about, if you updated the address with them, if they have updated address in the system, that may not happen. So, just to avoid any of this, we wanted to, this is a more critical thing because, if they want, if they were to mail anything to them, to you, then the first thing is that you wanted to make sure that the address is up to date. If not, then, obviously you won't receive any notice or, anything from them. And then you may miss the time, the deadline where the cover will be terminated because you not complying within the timeline. And then with this, our member services can assist, complete the form and return it to the county, and then we will also follow up, to make sure that it's get updated. So for auto renews, like I mentioned earlier, there's a possibility that, your case will get auto renews if they was able to verify all of the information in their system. So when you get, if you was successfully get auto renew, then you will not receive any renewal package, obviously. However, you will receive the notice, like this over here, where it's real, where it really say, your Medi-Cal coverage has been extended for another year already, and then, complete and return the following forms. And this following form is just really the language form and the voter registration forms. And they usually will have the return envelope along, with the notice, for you to return the language and the voter registration forms. This portion is really for the undocumented young adults. So at this point, individuals from 26 to 49, they will not eligible for full scope Medi-Cals because of the immigration status. However, by January of 2024, this populations, age 26 to 49, will be eligible for full scope Medi-Cals. Because of this reason, they do not want it to take actions at this, from April to December of this year to flip all of this, this population here, 26 to 49, into the restricted Medi-Cal, and then back to full scope Medi-Cal by January 2024, because by then, there's a law is already passed that, this folk will eligible for full scope Medi-Cal regardless of the immigration status. And because of this reason, then, they decide the first day, the first redetermination day for those folks over here, and then remember, this is only applied to undocked young adults, age 26 to 49, that their first day of their redetermination will be January of 2024 next year. So they can do everything all as one. They don't want it to do some of, during this time and then, go back and then, changes again by next year. And then also, when you complete and return your Medi-Cal's renewal package, it's not necessarily mean that you will be eligible for Medi-Cal's, right? Because things have changed, situations change, such as income. If your income is over the Medi-Cal guideline, then you may no longer eligible for Medi-Cal. What happened if that is the situation? Don't have to worry too much because they have an agreement with Cover California where they will transition your Medi-Cal case over to Cover California, and then Cover California will automatically to select the lowest cost silver plan on your behalf. And then the goal is to is really just to prevent any gap in coverage in between. Once you terminated for Medi-Cal, then you already have Cover California plans selected on your behalf already. So then, there's really no gap in between in this way. However, after they select that for, on your behalf, you still need to do something about it because ultimately this is still your choice. It's not like, Cover California or Medi-Cal kind of wanted to force you to get any of this, but the goal is really to prevent the gap covered in between. So what you're gonna have to do, you have 60 days. So you have 60 days to think about it and make the decisions. So the first option that you have is, you agree with this wonderful plan that Cover California selected on your behalf. Then, go to Cover California account, there will be instruction and then, accept the plan and pay a premium and then, the health plan will be effective. The second option will be you don't like this health plan, or maybe you have other choice. You don't like the health plan that Cover California select on your behalf, then you can go to the account and cancel the plan, or you do nothing during the 60 days. Then on the 61st day, then the plan will be automatically canceled on its own because it will assume that you don't like this plan because you did not do anything. Then the third option that you have is you can change the third option is you like Cover California plan. However, you did not like the plan that's already select for you. You can alter the plan that's select for you by lower the middle tier, or make it higher the middle tier depending on your own preference or your medical conditions. So you do have those options as well. Not like whatever that they select to you, you only have the option to take it or not. You also have the third option where you can select a different one. And then for Cover California support, they do provide 3 different support. They will send out a notice with all the instruction how you can, opt in, opt out, or, change to a different plan. And then they also have website where you can, go to the website and, follow all the instructions. And then, of course, they also provide phone service where you can talk directly to their representative about your selection if you wanted to opt in, opt out, or, if you wanted to select a different plan, you can also do that. And then for us, for Asian Health, for Asian Health Services specifically, we have our member services and patient navigator can also assist with the process. We can assist with the Medi-Cal renewal process, and then also with the Cover California enrollment. If you no longer eligible for Medi-Cal's, then you kind of wanted to opt into the Cover California plan. And below is our member services department's hours. We open Monday to Friday from 9 to 5, excludes holidays, and we close for lunch from 12 to 1, and then our number will be 510-986-6880. So if you have any question, feel free to give us a call for any of this.